the government in this week's Queen's speech have just been released. Ministers say protection for patients and the public is at the heart of the bill. The changes include supervised treatments for patients discharged from hospital to ensure they take their medication to prevent relapses. There'll be new rights and extra protection for around 5,000 patients with a serious mental disorder who are unable to decide about their care and may be unfairly deprived of their liberty. These include independent checks, a right to appeal and a representative appointed to look after their rights. Let's talk about these reforms. I can talk to Jane Harris, who's the campaign manager for the mental health charity Rethink. Nice to see you. Thank you for coming in. In terms of the whole mental health policy, is it as confused as some people are finding it?
Well, I think it is pretty confused, yes. I mean, the government has been talking in healthcare generally, including in mental health, about giving people more choices. And yet everything they're trying to do here is about restricting people's rights, restricting their freedoms. One of the things the government wants to do is bring in what is basically a mental health ASBO. Now, ASBOs are pretty controversial anyway, but why should we be giving them to people just because they've got a health condition? They want to tell people sort of when they might have to get home at night, where they can live, where they can't go. And actually that's not really going to help anybody with mental illness. If you've got a mental illness, what you want is care and treatment. You don't want a piece of paper telling you what you should be doing.
The difficulty the government will argue, and indeed many people will argue, here we are 24 hours after the horrific case of John Barrett, that too much emphasis is being given on the rights of the mentally ill and not enough on those who may come to harm if they're not treated properly.
Well, interestingly, the Barrett inquiry didn't actually say there was a need to change the law. They talked about changing procedures, they talked about changing staff training. There was nothing about changing the law. The law already exists to, protect people. If we think there's a problem and there's a danger to public safety or to a danger to a patient themselves, we can deal with that. We've got to realise that actually 95% of homicides in this country have got nothing to do with people with mental illness. In reality, most of them are to do with drugs and to do with alcohol. Now, just because of that, we're not going to say, oh, we should detain and restrict the freedom of everybody who goes out for a drink on a Friday in London. That would be the wrong way to treat Londoners, and it's the wrong way to treat people with mental illness. People with mental illness are members of the public too, and they should have rights.
Well, what rights do they have at the moment?
Well, in Scotland, people with mental illness have a lot of rights. Even if they are being detained in hospital, they have a right to a legal representative, as indeed do people in the criminal justice system. They have a right to a review within a reasonable amount of time. People in England and Wales have to wait 6 months before a review of their case, and the government's not going to change that immediately. They also have a right to decide when they're well, what they'd like to happen when they're ill, and who in their family they'd like to be involved in their case. Those are the kind of choices we really want to see implemented in England too.
Do you want people with mental illness to have the same rights as anyone else, or is that taking it too far?
Well, I mean, people with mental illness do have rights under the Human Rights Convention, just as anybody else does. But I think, why shouldn't people in England and Wales have the same rights as people in Scotland? We've got a system in Scotland that seems to be working well. Let's make it work well in England and Wales too.
Jane, thank you very much for coming in.
Thank you.
Harris, thank you.
Now, new measures to crack down on rogue estate agents will be announced by the government later today. All of the UK's 30,000 estate agents will be forced to join a scheme that will allow customers to claim compensation.